You've heard of flight simulation, where pilots learn to fly before going up in an actual airplane? Well, here at Ohlone College, we have Simulation 2 for something just as crucial as flight safety. This is the Ohlone College Human Simulation Lab. Here, student nurses learn to save lives before going into actual critical care situations. We'll provide you with a brief overview of what simulation is, the ground rules, the room setup, and how the equipment works. The Simulation Lab is a place for you to fully act out the steps you take in a real-life medical situation using high-tech equipment and devices. The philosophy of the nursing department regarding simulation is to create a safe learning environment in which students can engage in patient scenarios to develop critical thinking skills and obtain experience. You will not be graded on your performance, but your participation is expected and factored into the lab hours for this course. Students will be given patient information and background prior to the simulation. Basic ground rules for each student are as follows. Prepare for patient care in advance. Make a commitment to suspend disbelief. This is an acting exercise. Fully participate in all phases of simulation. Maintain confidentiality. What happens in the lab stays in the lab. And engage in self-reflection. Each of you will sign a contract to further engage your participation. This is a learning environment, so you can expect videotaping to occur. The videotape will be used for instructional purposes only and will not be saved unless a separate discussion occurs with you. We'll ask you to sign a release form for videotaping consent. Not everyone can participate in the actual scenario, therefore some students will view the simulation live in an adjoining room. These students will be expected to take part by carefully observing the scenario as it unfolds. Upon completion of the scene, debriefing occurs, where all students will gather to discuss the experiences associated with the simulation. Now, let's look at the room setup. We are in the lab. As you can see, there are 2 complete patient stations, a sink, a supply cart, hanging microphones, cameras around each station, bedside monitors, the mannequins, and a large one-way mirror that hides the control room where your instructors control the mannequins, a lot like the Great Wizard of Oz. There will be a quasi-nursing station with a walkie-talkie as a phone system off to the side within the lab area. You should attend scenarios dressed in your lab coat and wearing your name tag and stethoscope. Students are expected to act in a professional manner as if you were in the hospital. This is the mannequin. It has many human features, and we expect you to interact and care for it as if they were the real patient in the hospital bed. The baby Sim can cry. The mannequin, or Sim Man, can talk,
Can't breathe and my chest hurts.
cough, and even vomit. He may ask questions and can respond to your questions. He has many physiologic sounds: heart rate, heart murmurs, normal and abnormal lung sounds, normal and abnormal bowel sounds. You can obtain an oxygen saturation by attaching the probe to his finger. He can have a running IV and can have medications administered to him and tubes inserted, such as Foley catheters, chest tubes, and endotracheal tubes. He has the following pulses: radial and brachial, right side only, carotid, femoral, and pedal pulses, both sides. We can change his eyes to reflect different pupil sizes. In essence, you should assume he is a human being and treat him as such. We expect you will check his ID band and practice hand hygiene. We recommend taking time to listen to his physiologic sounds so you're familiar with the tones and pitches. The bedside monitor can reflect the patient's heart rate, respiratory rate, temperature, oxygen saturation, and blood pressure. The monitor operates by touch and is equivalent to the Philips monitor used in most institutions. We may ask that you first perform the assessment activity in order for a value and rhythm to appear on the monitor, i.e. cardiac auscultation for heart rate, etc. The blood pressure is obtained by selecting the icon on the bottom of the monitor that indicates BP, similar to the electronic BP machines found in hospitals. The values of HR, RR, and O2 saturation are dynamic. In other words, they change with the patient's condition, whereas the BP reading is reflective of the value at the last assessment. The student must select the icon to obtain updated BP values. Once this is done, you have successfully used and tested the equipment and devices that you will use in real-life situations. You should definitely feel more comfortable during your first time with a real patient. In seeing what this program has to offer, we hope you too value what the Sim Lab has to offer in your medical education. We look forward to working with you with this unique learning experience.